Well, among the most vulnerable since the pandemic started are the urban poor of India's cities. Day labourers and migrants from rural areas live in closely packed living quarters with little to no financial safety net. One NGO, Apnale, which focuses on the largest slums in Mumbai. CEO Arun Kumar joins us live now. Arun, good to have you with us. Just how bad is the spread of infections in a slum like Shivaji Nagar, for example, the largest slum in Mumbai?
Thank you for having me on your program. I think, 50%, nearly 50% of Mumbai's population lives in slums. And the infection since last year has been quite bad. In M East Ward, where Apnale works, close to 80% of population lives in informal settlements, which is locally known as slums. Since last year, there are two types of data that have been kind of missing from the entire narrative. One is district-wise or ward-wise data of testing. We have aggregate data for the entire city. Same is the situation even in terms of vaccination. We have entire city's data, but we do not have data at the district level or ward level. Given the huge inequalities among all wards, there are 24 wards in Mumbai, it doesn't help to develop any kind of granular strategy in the absence of data at the ward level. That's point number one. Point number two, I know that areas where primary health care is either weak or missing, people have struggled since 2020 to meet the requirements. We worked with close to 10,000 families last year. And of all the pregnant women that we worked with, 38% left Mumbai for their native places, because this is mostly migrant population, because they were not sure whether they would meet the delivery-related needs or healthcare. That's the kind of situation we are talking about. And in the second surge, as you know, things have been very, very bad, both at the medical front and also at the relief and social security front.
Yeah. Did the government provide any financial support to this group of people, these women, these migrant workers that were forced to, as you say, go home back to their sort of their regional areas?
The government has announced various welfare schemes. The interesting thing about India is that, and especially in urban areas, there is a huge chunk of population that remains unenumerated. They're not counted. So the last census that took place was in 2011. And at that point in time, about 2.3%, which would be roughly 3 crore people, 31 million people, who were not covered, who could not be covered in the census, and therefore they do not exist in the government register. So any welfare schemes that the government may have announced will not reach these people. Now, 31 million people, I know in the context of India or China, it's a small number, but I was just told that about 149 countries in the world have less population than 31 million. So that's the kind of mass of people we are talking about who do not have any kind of safety net. And that's point number one.
Sorry, Arun, yes. Yes, carry on.
In the local area where, in the slums, in the informal settlements where we work, 4% people do not have any paper whatsoever. So to avail any kind of government schemes, you need to have one of the 8 identification documents that the government has announced. Now, if that kind of people remain outside, say, for instance, food security that has been announced, at least for 1 month, everyone with a ration card should have access to free food. But about 25.3% people where we work have no ration card. So they cannot avail that food. So the point is that even when there are government welfare schemes announced, not everyone, and the most marginalized, are unable to avail those services.
Yes, and I mean, you're talking really, if you're not accounted for, you are not given basic human rights. And so often it's the women and children who suffer the most. Is that what you're seeing when you examine this?
Absolutely, absolutely, that's correct. Since 2005, overall trend of women's participation in labor force has been declining. It has further declined in the last 12 to 13 months because of the pandemic and the lockdown. Now, there is no pan-India number available in terms of the overall impact. But what we do know is that about 39% of people who had left big cities, metropolis, in the last, migrant wave that left cities, 39% of them have not been able to get their jobs back. And the majority of those 39% are women.
That is just
So they are the ones who have been pushed out of the labor workforce.
yeah.
As it is, their percentage was quite low, but it has gone further down in the last 12, 13 months.
So when you look at that lack of accountability for so many people, would you think the figures that we're hearing out of India are actually far worse than what the government is telling us in terms of infections and even deaths?
Unfortunately, we'll have to agree with that. In terms of death, for instance, India, the official figure is about 3,000 people dying every day. But there is, if you look at the number of people who are, given certificate of death due to COVID-19, that's far less compared to the people who are declared due to suspected reasons, suspected due to COVID-19. That number is larger than the actually determined number of COVID-19 related death. That's one. If you look at the numbers from burial grounds and crematoria in the country, now this has become, unfortunately, a kind of near consensus that those numbers, unofficial numbers, are much higher than what we hear from the government quarters in terms of the total number of people who have lost their lives.
A tragedy as it continues to unfold. Arun Kumar, thank you very much for your time.
Thank you for having me on the program. Thank you.